The Anambra State government, through the Ministry of Health, has held a 2-day residential training for community-based maternal, perinatal, and child death surveillance and response team in Oka. The exercise, which is a training of the trainers, attracted reproductive health officers from the 21 local government areas of the state. Correspondent Chibuzo Okoye has details.
Speaking during the training, the Anambra State Head of Reproductive Health, Dr. Uju Okoye, revealed that Anambra is the first state in the southeast to implement the maternal and perinatal child death law eulogized Governor Chukwuma Soludo for approving the training and noted that it is a big step towards the reduction of maternal mortality and morbidity rate in the state. Dr. Okoye explained that the people being trained would in turn go to the various communities in the state and train those who will be in charge of child death surveillance and response in order to get accurate data that will help the government to make accurate planning for prevention of such deaths.
Always advise them that they pay attention and get the nitty-gritty of the program so they can be able to replicate what they are being taught and be able to harness the communities in giving us the accurate data.
The head of Department of Obstetrics and Gynecology, Anambra University, Oka, Associate Professor George Eleje, said that the training was as a result of the high mortality and morbidity rate in Nigeria and commended the Anambra State government for organizing the training, which he said will help to collect and document realistic data of those children and women who die in various villages but were not documented.
We now looked into it and found out that the issue is that the data are not well collected. And again, it's not only a question of collecting data. We also need to audit, review the deaths to know the cause, how it can be prevented. And that is the key thing. So, because we know that prevention is better than cure.
One of the participants at the event and head of reproductive health in Anambra East local government area, Mrs. Adeza Lohu, promised that they will do their job judiciously and equitably. Recently, the wife of the governor, Mrs. Nonye Soludo, distributed anti-shock kits to various hospitals in the state, also geared towards the reduction of maternal and mortality rates in the state. In Oka, this is Chibuzo Okoye for ABS News.